Hi, my name is Bethany Overfield. I've been a research geologist with the Kentucky Geological Survey for 16 years now. I'm starting to tell people that I started when I was 12, just because that makes me feel a little bit better about my age. I'm going to talk about geohealth initiatives today, but before I dive into the initiatives, I want to talk a little bit about what we mean when we introduce the concept of geohealth. Geohealth is a relatively new moniker for a field that's been around for quite some time. It's essentially the intersection between earth sciences and health sciences. Geohealth research encompasses studying causes and predictability of natural hazards. Some examples I'll go through here: geologically sourced airborne carcinogens like radon gas, silica dust, coal dust, and asbestos fibers, and also geologically sourced carcinogens found in sediments and soils such as arsenic, cadmium, and inorganic lead. Obviously, there are many more examples. I just wanted to give you a few. Geohealth research has the potential to affect policy, to raise awareness, to reduce impacts, and most importantly, to build more resilient communities. Although geoscientists have studied aspects of geology that do impact health, we haven't historically done so collaboratively with other health scientists. At KGS, however, we see collaboration and integration as the best possible way forward in accumulating the most robust research possible. We've had the good fortune at KGS to be able to work with the UK College of Nursing and also the UK College of Public Health in a couple of different initiatives over the last couple of years. I have with me today Ellen Hahn. Ellen is with the College of Nursing, and Ellen and I started an initiative and a research program probably maybe 5 years ago, maybe 4 to 5 years ago, on radon research. So I'm gonna tap out and give it to Ellen, and I'll take it back a little bit later. Thank you, Ellen.
Right, thanks, Bethany. Probably wondering what's a nurse doing in a group of geologists, right? And I'm a little bit of a different kind of nurse because I'm a public health nurse. And so what that means is I'm interested, my patient is the population actually, so the whole community. And so this was an interesting, or has been a really interesting collaboration with Bethany and Drew. And we've been doing this for a while, but essentially I am a full professor in the College of Nursing, and I head up a kind of a growing group of faculty and students and staff in the College of Nursing, and it's called Breathe. And so we are interested in research. We do a lot of community outreach and practice collaboratives in the College of Nursing. And you see our vision, you know, Bill talked about your vision and your mission. Well, we have one too. And our vision is really all about access to clean air. I'm personally an asthmatic, and I have a hard time breathing when the air is smoky or it is full of pollutants. And so that's my personal story. But my goal as a nurse is really to create an environment where people don't even have to think twice about breathing healthy air. And so our mission is really all things lung health, healthy environments, health equity, which really means making sure that even people in the hollers of Eastern Kentucky, people who are low income, people who are maybe more disadvantaged than those of us who maybe live in Lexington, can also have access to clean air. And so we do research, we reach to the community, we have projects in just about every part of the state, and primarily now in Southeast Kentucky as well. We do advocacy, we do policy development. There was a question earlier about policy. My doctoral degree is in health policy, so I believe I'm a scientist advocate, or an activist, if you will. And so we're also interested in making sure people have access to evidence-based healthcare. And so just a really quick look at our chart, and I want to point out, I think there's a little, is this a, yeah, perfect. I just wanted to point out with this collaborative, you'll see down here that we do tobacco policy, we do tobacco treatment and prevention, we do radon, and that's really what I want to talk about, what we're going to talk about. And then interested in special populations. Perhaps what you might know me best for is the Kentucky Center for Smoke-Free Policy. And our group really worked with Lexington and Fayette County, urban county government, and provided a lot of technical assistance and research to inform Lexington when we went smoke-free. And if you've been here a while, you might remember when bars and restaurants were smoky. So that's a big part of what we do. And in the last 8 years, we've been working with the state health department. Clay Hardwick's here in the back. He's the radon manager for the state health department. We have worked on a variety of issues with radon awareness. You're probably wondering why we do that. In a minute, I'm going to tell you. But we also have a biostats group, and they have been actively working too with the KGS in some radon projects that we've been doing. So just a really quick about the intersection between health and geology in this case. The reason I reached, actually, you didn't tell your story, Bethany, but you actually reached to us when you saw one of the UK news stories about the work we were doing with radon and lung cancer. And so you may not know that Kentucky leads the nation in lung cancer. It's a concern of mine, and it's a concern of our colleagues. And radon's actually the second leading cause of lung cancer. You may not know, and I didn't know until about 10 years ago, that if you're exposed to both radon and tobacco smoke, you're actually 10 times more likely to develop lung cancer. So that's what got me into the radon world. And that's, I think, what made Bethany and Drew reach to us and said, hey, but do you know rocks are part of radon? And that's where radon comes from. And I said, yeah, but I don't know anything about rocks. And so, you know, we're interested in reducing high radon potential and figuring out what parts of Kentucky have the highest radon potential, and mapping that along with smoking rates and secondhand smoke exposure. So that's a quick way of saying what we do. And so initially, when Bethany got a hold of us, we were using this map, and the EPA puts this map out. And I had no idea that it may not be the best map in the world because I don't do mapping. And so we were using these county-based maps, and they really inspired our relationship because these maps are simply based on observed radon values. So when somebody calls Clay and says, hey, Clay, can I have a free radon test for my home? He sends it and then keeps track, the whole country really, EPA keeps track of just the observed radon values and doesn't take into account the rocks at all. And so we have been looking at radon data over a period of years, and we've analyzed county and zip code. And what our colleagues at KGS said, wait a minute, political boundaries may not be the best way to think, you know, the rock doesn't stop right at the county boundary. And I didn't know that. I had never thought of it as a nurse. So we were interested in radon levels having the potential to vary by county and certainly within the context of geology. So that was why we moved forward. And so we've really done 3 initial collaborative studies, which is pretty cool. And again, I think I told someone at the break, when we first started talking, I didn't know your language at all. And some of the first couple meetings were funny, actually, and pretty interesting, you know, because I never even took a geology class as an undergrad. So, I mean, so we had to get through some of the language barriers, but it was okay. So we had some data, and really just 65 data points. Initially, we had a very small pilot study in Boyle County. And so we combined some of those test results with geology. And so we met with our colleagues in KGS, and they created these really cool maps. And I remember you brought them in hard copy to our office. And I was like, whoa, that's so cool. And then they said, well, come over to KGS and let us show you on the computer. So we went to your fancy classroom, and we also looked at them, and we learned some things in those early times. Then we moved to looking at a few more data points, 309 data points, and we got our statisticians involved And we looked at the validity of the association between the rock formations and these radon testing results in a small part of Kentucky. We actually got together and were successful in writing and publishing a paper together in preventive medicine reports. And I remember the reviewers, when we submitted this, they're like, what are you doing? Like nurses and geologists working together. But we had got really great feedback. And I think they were so shocked to see this manuscript that they had to publish it, right? But we found out that there, in fact, you can use geology to try to determine what your lung cancer risk is. And that was pretty exciting for me because, you know, as a nurse, I would love to be able to say, let's go into that neighborhood, let's go into that part of Kentucky and try to get people to test for radon, to fix their home for radon, and by the way, quit smoking too. So, yeah. And so this third study is what Bethany's going to talk about more. And this is what we're working on now. We haven't published it yet, but we were able to come up with over 60,000 radon values over a period of about 20 years in the work that we do with the companies that do short-term radon testing. And then we could combine that with the rock formation data. So I'm going to turn it over. I think that's next. Yes, I'm going to turn it over to Bethany to talk about it. Yeah.
As a researcher, anytime you're given a data set that has 60,000 values, that was truly like one of the best days of my life. So, which is sort of sad in a weird way. But so initially we cleaned up the data, we looked for duplicates and got it ready to go. And what we first did is we intersected radon data with the 24,000 K geology data. That's the first thing that we did in GIS. And then we were able to assign a radon value to each geologic formation. So we could create a statewide radon potential map that you see here. So as you can see, this looks a lot different than the black and white maps that the EPA produced. So I just want to go a little bit into looking at a couple of specific counties. First of all, I want to point out that we talk about radon in terms of picocuries per liter. That's the unit. The EPA action level for radon is 4 picocuries per liter. The World Health Organization, they have it at 2.7, so it varies. So when we look at the EPA maps, we see Christian County up here at Edmonson County. Christian County on the EPA maps, it was just a blanket slate of greater than 4 picocuries per liter. After we did our geologically based maps, down here you look at Christian County and you see there's quite a bit of variability because of the geology. It's based on geology. The bottom half of the county actually is listed at having radon potential of greater than 16 picocuries per liter, which is extremely high. Conversely, when you look at Edmonson County, it was listed as having less than 2 picocuries per liter. But the maps that we created showed, it did show, you know, it's pretty low in Edmonson County. However, some of you in the back probably can't see this, but in the southern part of the county, there are geologic formations that are prone to high radon production. And so it may give somebody a really false sense of security if they see that their county is at 2, when really if they live in the southern part of the county, they could be in danger. But really they could, you know, you could be in danger anywhere because there's just such great variability. So we plucked out the 120 counties and county maps, and we created infographics that we were going to disseminate to the public. The most important thing for us in doing this was to create content that was easily digestible for all audiences. I didn't want to deliver information in picocuries per liter. We went back and forth about this infographic and had some really good meetings. How are we going to talk about this? And so we decided to talk about it in terms of risk. And so we have least danger, mild danger, danger, and so on. And so these are all 120 county maps are available on the web. I have to give a shout out to my student Darren. He's in the back. Darren, wait. Darren helped me do GIS work for all 120 counties. He's just graduated and he's available for work. So he'll go to the highest bidder too. So we have 120 of these. They're available on the web. And also we put them, we go and we do, well actually I don't, but Ellen's team will go and meet at public health departments and talk to people about how to use this data, how to disseminate this data, and what it means. And we have these printed off in color. And so on the back of it, we just talk about a little bit about, we show a map where the testing has been done, but the whole point it really is to get people to, number one, become aware of danger associated with radon, and also to test their homes, because it's relatively inexpensive to test your homes. So that wraps up all of the work we've done so far. And so I want to talk a little bit about what we want to do moving forward, because I feel like we're just at the tip of the iceberg with our research. One thing that we would like to do is use the existing data set. We have 60,000 data points. What else can we do with it now? One thing I would like to look at is climate and seasonal influence on radon gas migration. That's something I really want to focus on. I also want to look at the life cycle of radon as it pertains to geologic units. As a geologist, I can't wait to do this. This is something that is really interesting to me. When we did the map, the first run through, we just assumed that the Devonian black shale would have the highest values. And the Devonian black shale does have high values, but Mississippian limestones actually have higher values. So you can see this ring of red, these are the Mississippian limestones. And then Central Kentucky Ordovician limestones also are really quite high. So I'd like to study that, obviously. Also too, I'd like to be able to acquire equipment to take soil gas samples in order to validate and verify the county maps that we've already done. Obviously, the residential radon data set is great and it's robust, but it does have some limitations associated with it, because they are residential radon values. So I'd like to be able to validate what we've already done. And additionally, we'd like to look at targeted population-based lung cancer prevention studies as well. So that kind of wraps up what we've done what KGS has done in the realm of radon. And one thing that I want to talk about next is something that we've done with the UK College of Public Health, and we call that human health mapping. And so smoking rates are the same in both the Eastern Kentucky coalfield and the Western Kentucky coalfield. However, lung cancer rates are much higher in Eastern Kentucky. Nancy Johnson with UK College of Public Health has conducted a pilot study to assess contributing environmental factors, and we call this human health mapping, as a part of a larger DoD-funded case control study in Appalachia. So what KGS has done, or specifically what I've done in helping Nancy, is I've just focused on helping her in mapping efforts. And so we've done a couple different things for her. We've done some water quality data maps. We've also done some proximity and density analyses, and we did those for parameters that may impact health. And then we've just started looking at, with Bill, we've started looking at what we're calling valleyness or valley context exploration. So if you think about Eastern Kentucky coalfield and the Western Kentucky coalfield, one of the greatest differences obviously is topography. And does the topography and are those deeply incised valleys in Eastern Kentucky causing health problems? It's just something that we're kind of starting to think about. So in closing, I feel like KGS is just starting to explore numerous research opportunities in the emerging geohealth field. Our collaborative efforts with both the UK College of Public Health and the UK College of Nursing really exemplify our goal of integration. We look forward to many future opportunities within the university and beyond. And we'll be happy to we're running late, but we can probably answer a question or two if you guys have any.
There's clearly going to be time continuum. Have you looked at anything to try to tease out variation according to time?
No, that's actually what I was kind of talking about with climate and seasonal variation. Really, the only thing that we've had time to do so far is just outputting these 120 county maps. But we're going to dive right back into the 60,000 data set soon and hope to be able to kind of commit for more things. So. Yes.
So have you interacted at all with Ellen Sanders?
I'm sorry.
Have you interacted with what you're doing with
Ellen, you may be, have we interacted with the Cabinet for Health and Human Services?
Are you talking about the Kentucky Cabinet for Health and Human Services in the radon program particularly, or in the environmental health? Actually, yeah, Clay Hardwick is in the back. We actually have had a contract with the State Health Department now for what, 8 years or so, and it's kind of grown over time. We're doing a whole lot actually with them. We have a project now in Northeast Kentucky along with the Northeast AHEC. to develop a way not only to help people test, but also help people mitigate, because that's the biggest problem with radon. I mean, you can get people to test, but it's really expensive to fix, and particularly in low-income areas. So we're doing a whole heck of a lot, actually. And we actually have a continuing education, free continuing education program about radon on our website. It's actually open to anyone that you can take online. That's a little commercial. I don't know if, and then the Environmental Link group, Janie Cameron, I don't know if you know her, but they're working also to fund some radon projects. The Northeast Kentucky Gateway District just got money from them to do that. And so we're doing a heck of a lot of radon testing, which of course makes our collaboration great because more data, right? More data points. And the 60,000 data points actually came from 2 companies that primarily serve the state of Kentucky. So the test kits that Clay and his folks give out, those data points, those 60,000 data points come from those companies who've been kind enough to give us the data over the past 20 years, and we now have IRB approval, you know, to like keep going in the future. So we're going to keep adding to that data set, which will just get bigger and bigger and bigger. So I don't know if that answers your question or not, but yes, we're doing a lot with them. Yes.
Thank you.